Good morning and welcome to another edition of United Way for Southeastern Michigan's What's the Word Wednesday. I'm Audrey Walker, and today we will be going over resources to assist our mental health and how to deal with both seasonal depression and coping over the holiday season. As always, the last 10 minutes of today's town hall are reserved for questions. So if you're watching on Zoom, please leave questions in the Q&A box. If you're watching on Facebook, leave those in the comments section. Today, we are so honored to be joined by Juliana Harper, Chief Program Officer and Senior Vice President of Easterseals, Michigan. For those of you who may not be familiar, Easterseals is a national organization that is focused on serving those with autism, developmental disabilities, or other special needs. The organization has been in Michigan serving our communities for over 100 years, and they aim to make sure each client can live up to their full potential, learn skills needed to thrive as they age, maintain work, and overall live their best life possible. Now, Juliana is a master level social worker, undergrad and graduate alumni from Wayne State University, and has been with Easterseals since 2008. Prior to Easterseals, she has served as the Administrator of Clinical Services at Training and Treatment Innovations Incorporated, where she maintained the role of supporting individuals in the community during the closing of Clinton Valley Center. Overall, she has had 20 years history working in the behavioral health field in a variety of roles, including inpatient medical, home health, community mental health settings, working with children and adults, as well as traditional outpatient mental health and substance abuse settings. She loves to spend her free time cycling, hiking, fly fishing, backpacking, and playing in the great outdoors with her husband and son. And for relaxation, she loves to read and cook. Likewise here, Juliana, and I'm so glad to have you here with us today. So thank you for coming here today.
Well, thank you for that very warm welcome. I forgot that I like to do all those things. It doesn't seem like we can do much of that right now, though, in this cold, dreary day. But thank you for having me. I'm very happy to be here. All right, I'm going to go ahead and start the slides. Am I showing appropriately? All right, thank you so much. I'm so happy to be here. We are very thankful for the partnership that we've had over this last, seems like 2 years with the United Way of Southeastern Michigan. And I'll talk a little bit about the unique things that we have done together as a result of some grant funding that we have received. But a little bit about who we are. Easterseals has, as you know, Audrey had mentioned, we have over 100-year history within our community. While we've changed and adapted over the years, our mission really is to address the increasingly complex emotional, intellectual, social, educational, physical needs in our community. Easterseals' purpose is to lead the way to 100% equity, inclusion, and access for people with disabilities and the greater communities that we actually serve. We do this through enriching education, enhancing health, expanding employment, and elevating our community. We've been an indispensable resource for individuals and families affected by disabilities, and that includes behavioral health conditions, mental health, addictions, children and young adults on autism spectrum disorders, and also those with developmental disabilities. Our continuum is it's still interesting to me because many people in our community are really surprised and unaware when we highlight how we serve our community. Our continuum is pretty large in our behavioral health services. This past year, we served over 16,000 individuals and families per year. Most of that has been, I would say, probably in the Oakland County area. Our next largest site would be Macomb County, then Genesee and Kent County, and we serve families throughout Michigan, either in one of our facilities or either through a telehealth platform. We have over 500 staff that are skillfully trained to provide the supports and services at one of our 11 locations in Michigan. We have several service offerings for children, as you can see, and adults. And then we have programs that have a special focus on older adults specifically, military and veteran, and their families, as well as our agribility program, which is a service for farmers that have injuries or illnesses that impact their ability to do their jobs. So we do adaptive, rehabilitative work with them so that they can get back to farming. It's a really unique program, and that program services all of Michigan. We also have 2 adaptive fields. We partner with the Miracle League of Michigan, and that gives an opportunity for children and adults with disabilities to play baseball on an adaptive field. So that's one of the really unique things. And we have 2 locations, one in Southfield and one in, I believe it's Lake Orion or Orion Township. Much of our services focuses on behavioral health needs, as I mentioned, autism, trauma, addictions, and individuals with comorbid medical conditions. So they probably have a behavioral health or addictions, condition, and then they also might have, hypertension or some other chronic disease that is impacting their recovery. All of our services here, not everyone's going to be eligible or able to access everything. It really is based on need. Our services are determined based on a level of care at intake. We screen individuals in, and then we also have several contracts with community mental health centers or the prepaid inpatient health plans to serve the really at-risk population. And we'll do that in a variety of ways. So we may go into the community and provide services to at-risk people in their homes or whatever setting that they're in. We also have outpatient facilities that individuals come in. And obviously during the pandemic, we shifted to a telehealth platform where we were able to offer both. And at this point, we have folks that come in and receive treatment, and we have people participating still with, through telehealth, which is, we're trying to be adaptable to what the community needs. And I think that that's really important to us as an organization. We also accept major, insurances and other health plans in order to provide services. And some of the unique things that we've been able to do with our partnership with health plans is to really kind of innovate and look at using the continuum of care that may be available through a community mental health benefit for Medicaid only individuals, and offer that as an alternative for folks that are really underinsured, that have serious mental health issues and may not have that as part of their insurance benefit. So we're working on some pilot programs around that. And this is really, it's how we enhance our community. We really, as an organization, we feel we have a role to provide enhanced care, best practices, making sure that we are able and ready to serve multiple people, depending on what what their needs are. One of the things that we have really focused on in the last year was to become a certified community behavioral health center with Michigan. Michigan's going through a demonstration project with the federal government, and we were selected and recently certified to do that here in Oakland County. It was a very proud accomplishment for the organization, and what this will afford us is we will be able to provide a continuum of care for anyone who comes through our door. So that's regardless of their insurance, regardless if they're uninsured, where they live. If they request services, we will screen and assess, and we will initiate treatment. And so it's something, as I mentioned, we're very proud of. Some of the other things that we focused on, we're in our 4th year of a SAMHSA grant for trauma-focused infant and early childhood. This really gets at the early part of working with caregivers, parents, and that under the school age, typically under 6. And we actually are doing parent coaching. We're working with Great Start programs, some of the early childhood centers, in order to do consultation, mental health consultation, and home visiting models, so that we can really impact at an earlier stage and hopefully change the trajectory of that child's growth and development as they age. The other thing that I wanted to mention is that this past year, through our accreditation, we just were accredited as a behavioral health home, and we are working on a pilot with Medicaid in the state of Michigan as a pilot in Oakland County to provide behavioral health home services to individuals that are receive Medicaid. It is a really intense integrated care model for both health and mental health needs, and looking at how to bridge and provide care management for both those conditions, while making sure that folks stay in the community and work on their own health wellness plans. As I mentioned, we have some really unique things with insurance companies. We're working with Blue Care Network now on two innovative programs for, they're calling it an adult intensive services and children with autism spectrum disorders. These are really more in enhanced services for this population that traditional outpatient services hasn't been able to help address maybe their complex needs, and they may end up back in the crisis services or the hospital more frequently. And so we are providing more care management, case management, more intensive services for them. So that's one of the unique things that we are doing. I just realized I don't know if my slides are working. Okay, there we go. Sorry. So this, I'll step one back. These are the services, and we'll have our slides for the presentation for you as well. Mentioned the unique programs. And then one of the things that we are very pleased about was we've actually had 3 opportunities working with the United Way of Southeast Michigan. And the first grant that we did, we actually had in partnership with Oakland Family Services. This was at the start of the pandemic. We were able to use the funding that that United Way provided so we could scale up the equipment needs to do the virtual essential behavioral health services. We were able to pivot pretty quickly within 3 days of the pandemic, when everything kind of shut down, and moved all our services virtually. But what we realized is that not everyone had the same connectivity. We had old equipment for our staff. And this really afforded us to really look at purchasing equipment, information sharing. We did a lot of promotion on social media and troubleshooting for individuals that were having a lot of virtual technical issues. So together with Oakland Family Services, we served over 8,000 individuals with this extra support. So that was pretty amazing during that time period. The next thing that we had, which we thought was, which is another amazing, it happened in July 2020, again, during the pandemic. This was the COVID Community Response and Recovery Fund. What we focused on in this one was we looked at our population of individuals we serve within Oakland County, which is roughly around 6,000 individuals at that time, and looked at how do we get technology so that individuals feel that they can connect remotely, because what we were seeing is that even though we were open for business, folks did not want to come into our facilities, nor did they want us to come into their homes. And so we really needed to think creatively how we could use technology equipment and remote monitoring devices to monitor health conditions. We use the CDC guidelines with an algorithm to really promote the highest risk. And we narrowed that down from thousands of people to the highest risk population, including seniors, and those with really complex medical issues. And we were able to serve 426 seniors, adults, and children with complex care needs through this model. And that puts, iPads and blood pressure cuffs and that in their homes that we were able to connect and monitor. So that was pretty amazing. We also used that, the grant dollars to put iPads into some of the school partnerships that we had already established so that we could do some telehealth, because we were not allowed in their facilities during COVID when they were open at that time either. So this was really helpful for us to really focus on access and accessibility. The last one, which is what we're really excited about, this is the one we were just awarded in November this year. And this is the Oakland Together Mental Health and Wellbeing Grant. So this one is actually very near and dear to us. One of the things that we have established with our children and family services is we established some school mental health programming. And we noted over the last several years in a community need that there is an uptick of mental health needs in children and adolescents. We had already partnered with eight districts in Oakland County to provide either a referral partnership or actually co-locate staff into their facilities. This particular grant is going to help us expand that. We're going to be adding in additional schools. We're adding, we hope to serve an additional 500 students and individuals through screening, assessment, crisis intervention, mental health consultation, parent support, and access to evidence-based treatment. The other unique thing is what we've heard from our community is that parents need a lot of support. And that came out of the pandemic, but what we're still seeing is that there really isn't a lot out there to help have a curriculum that parents can access either virtually or face-to-face that helps them understand development, social emotional well-being, and dealing with challenging behaviors and support. So this is something that we're really pleased to be offering the community, and we'll be targeting more about that probably as we phase in, probably by March, we'll have the platform for parents up and running, at least that's in our timeline. Which is a nice segue at this point. So what we've learned through the pandemic and what many are feeling is this increased feeling of depression and anxiety. Coupled with changing seasons, it can create even more of an issue. In a survey about holiday blues, 64% said they were affected and 24% said holidays affect them a lot. So for most individuals, the holiday blues are a temporary feeling of anxiety or depression during the holidays that can be associated with, extra stress, unrealistic expectations, or even memories that accompany the season. So for example, you may be thinking of a lost loved one who passed away, or you might be thinking of that you may not be gathering for the holidays, especially with the pandemic. You might have expectations of a family event that should be peaceful and joyful and happy, and then due to family dynamics, there's a letdown. All these are very natural, normal things that happen. But being mindful of how you're feeling and how long you're feeling these feelings is really important for first tool in recognizing your winter blues. This is supposed to be the most joyful, but it's also probably the hardest time of the year. The weather is colder, people tend to gravitate more indoors. There's less to do because of the weather, and we're in the northern hemisphere, so it's cold, wet, dreary, it's darker earlier. The lack of sun all contributes to these factors that increase the stress and influence the winter blues or anxiety or depression. And then you have the holidays. So you have the stress of the busy season, overindulgences, changes in our structured routine. And for children, the holidays in this time of year can be challenging because of the lack of routine or the interrupted routine of what they're used to. Later nights, more sweets, this all impacts our moods just as it does with adults. So the holiday blues, though, are meant to be kind of temporary and not long-term. So in thinking about that, when should you be concerned about it being more? This is really, it's important to kind of, when you think about it, when you're experiencing feelings that last more than 2 weeks at a time, these depressive feelings are mostly every day and they last for a significant period of time. That's when you should start, pause and maybe think about this. It could be you might have seasonal affective disorder, otherwise known as SAD. It's a medical condition that happens seasonally for individuals, and it's a diagnosable depressive disorder. This condition affects people, their mood, their thinking, their sleep, their appetite, and their energy levels. It typically gets worse during the colder, darker months. So we're talking about a 4-month, 5-month span of time, and then it gets better in the warmer months. So this again has a lot to do with the lack of sunlight, daytime hours, which has a lot of influence in this disorder. And research shows that depression affects over 17 million Americans. And then of those affected, 35% don't seek help because they really don't understand what they're experiencing or what they're having. So if you're thinking you're experiencing a seasonal affective disorder, consult with your physician or get evaluated by a behavioral health professional. That is, we also offer free screening on our website that you can go in and there's actually several different screens. You can do a general overall wellness screen, which would get to certain questions about depression or anxiety. And then there is an additional one that focuses specifically on depression. So those are both, they're on our website for free, anonymous for you to access. The symptoms are typically, as noted, just low energy, sadness, no longer enjoying things you used to, appetite changes, weight loss, gain, anxiety, and oversleeping, which, again, and the thought about this is that it lasts for a significant period of time. It doesn't come and go. It's with you for, more than 2 weeks or longer. So what do you do? How do you combat these, either whether it's the winter blues or seasonal affective disorder? There's a lot that you can do about this, and sticking with a schedule as much as possible. And this goes with the holiday season too. So it's disruptive. It's a very disruptive time of year. We enjoy it and we love it, but there's a lot of good things that come out of it, but it also impacts, whether you have the winter blues or seasonal affective disorder. So some of the suggestions we have here is, of course, unplug. Social media, being connected constantly. We use our phone. They're all distractions, but sometimes they can be an irritant versus adding contentment to your life. So maybe unplug a little bit more, making sure you're putting that down a long time before you go to bed. Do not disturbs on your phone for a while. Just unplug. Moving your body, even if it's just a little bit. Studies show 10 minutes a day, just getting out walking. And you can add it, if you can add it outside, that's even a little bit better. Even though it's cold, bundling up and getting outside and soaking up any amount of sunlight, even though you may not see it on a day like today, actually does the body really a lot of good. Talk to your physician about adding a vitamin D supplement. That may be something if, we live in Michigan, we don't get enough sunlight and we can become vitamin D deficient and during the darker, colder months. And this may be something that would aid in your recovery. Spending time with your loved ones, people you enjoy, adds to your feelings of comfort and contentment, laughter, getting cozy creates contentment, and showing gratitude, doing things that provide you self-care. For example, journaling at nighttime, writing down your thoughts, writing what you're grateful for, maybe changing, have a different practice during the daytime or at dinner time with your family, and just saying, what are we grateful for today? Doing Epsom salt baths, again, all very around self-care. And keeping that regular sleep schedule, eating healthy, drinking lots of water, and really trying not to overindulge in alcohol or, avoid drugs. I think that's, the biggest thing. And for children, just like adults, they need structure, they need healthy diets, and they need regular sleep cycles too. And I think getting outside and playing and being active will help them tremendously, just as it will adults. The one thing is that they recommend don't do major changes right before going into these winter months. So if you're thinking that you may be wanting to stop taking a medication because you're feeling really well, maybe going into the winter months isn't something that you'd want to do. incorporating light therapy maybe is something else that would be very helpful.
Yeah, these are all great tips, definitely to share with us. And I know a lot of good information that people can take with them through the holiday season. And I see you've got where you're located here. And that kind of goes into some questions that we had. So I know you mentioned there are, you can get services here by calling this number. And you mentioned your website as well by being able to do some free evaluations. So can you expand a little bit more on that, just continuing to focus on mental health, behavioral health, coping strategies, especially given the recent tragedy in Oxford? What are some of the programs that can be offered to individuals or families dealing with grief and tragedy?
There are, I know in the community, especially in the Oxford community, they are offering, and they have offered, and they'll continue to offer some, very brief grief counseling, crisis counseling at some of the locations for the families. I know that they had hosted a few events across the county for other schools and other districts. There are so many, again, we have resources on our website to access points. I know that the Oakland County Community Mental Health is looking at, contacting their access department, looking for providers is one way. The Blues are offering some additional supports and services. I think the whole community is ramping up. So when in doubt, even at that, calling us and we'll help triage and figure out where you need to go. Sometimes there is also this National Suicide Prevention Hotline. Common Ground also has a 1-800 number for folks to contact when they need someone to talk to. And it's just, I think sometimes it's just, some people need to verbalize and talk through, and talk therapy could be a very useful. Some folks that have, that had experienced a tragedy themselves might need a little bit something different. And I know that the school is helping to find resources for that, for that population.
And as a parent, like, how do you introduce that to your child, especially if they haven't, I don't want to say accepted it, but they don't know, they're still exploring how they're feeling, what they've experienced?
Patience. So, I have a 7-year-old who I didn't think knew anything about it. And out of the blue one night, he brings it up, and I was prepared. We were thinking we were going to target it very different. For younger children, your approach needs to be different. And I know we have a video on our website that kind of talks about how to talk to your children about tragedies such as this, and how to deal with the fear that they may be experiencing. The thing is just be present. You may not have all the answers, and gently nudge, check in. Don't expect that, especially adolescents, don't expect that they're going to bring you what their concerns are. You may just have to remind them that you're there to listen and just hear them out, and just nudge them a little bit. Ask them, leading questions. How are you feeling with this? Do you have any other thoughts? And if they say no, they will open up when they're ready. We know that adolescents, they're more in their formation of their friends and their units of, and bonding that way then. But it's like, maybe you lead in with, so how is your friends dealing with this? Has so-and-so said anything about how they're dealing with it? And then it gets them into talking about it. If it's not about them, it might be about their friends, and then it opens the conversation.
Sure, that's great advice. Definitely. We just have a little bit of time left, but I'm curious, from your point of view, what's something about Easterseals and the work you do that people don't commonly know about, maybe a hidden gem or something that you really want to make sure that people are aware of?
Oh my gosh, there's so many. Well, we do have a maternal infant health program that I don't know that it's for, we do prenatal services, really focusing on that early intervention. And that is something that we have just begun, and we're launching. And excited about that because, again, we're starting at, we're adding that support to mothers so that they're bonding and building that engagement with their their little ones early on, and then providing, a continuum of care thereafter. So we're really excited about that one, and we're not sure that many folks know about that.
Mm-hmm. Well, that's all the time that we have for questions today. I'm so glad you joined us and sharing all of this wonderful information about Easterseals, Michigan, and all the support you provide and continue to provide to our communities. So many families and children and mothers, all need that support. And it's so great that you're here to provide that. So I just want to say, as a reminder for those of you who may be experiencing a need, our 211 helpline remains available 24 hours a day, 7 days a week. We maintain a running list of available services in the community and can connect you to the supports you need. You can also look up resources in your area by using our 211 resource database at unitedwaysem.org/211. And I just want to say thank you so much to all of you who have been joining us this year for our What's the Word Wednesday. We will be taking a pause just to take a deep breath and enjoy the holiday season. And we wish you a peaceful end of the year and look forward to reconnecting in 2022. So happy holidays to all of you. Be well, get some rest if you need it, and we'll see you back here real soon.
Thank you.